Hello, everyone, and welcome back to class. This is our screencast for week number 2, creating a PICO. So as you might recall, in the introduction email that I sent out at the start of class, I noted that in the first screencast, in the week 1 screencast, I had described that we would be exploring this topic in week number 3. However, as I was continually fine-tuning the class, I decided to switch week 2 and week 3. So please don't get confused. If you go back and look at the first screencast, it says that the PICO assignment information would come in week 3. That is incorrect. It is here right now, week number 2. So in this first screencast of week number 2, let's talk about creating a PICO. So you're going to have questions. You're going to have questions in clinical practice. What do I do? You're going to face situations where you're not necessarily sure what the best treatment approach is for a patient. Or you may be curious and you want to have more information. You'd like more information about X, Y, or Z. And that's where searching the medical literature comes into play. And to help you in that process, you can utilize the PICO. So PICO is what you're going to commonly see people use. Sometimes you may see the PICO double T. PICO stands for population, intervention, comparator or comparison, and the outcome. Now, I'm not going to read through this particular slide here. If you want to read through this, please go ahead and pause the recording. Otherwise, we're going to explore in a little more detail in the next slide. So the PICO is very common. It is used as a way to help us think about a patient population and to kind of focus our ability to search the medical literature. So again, what does P stand for? That stands for our patient or population, or sometimes it's written as the problem. And so here is where you're looking at the important characteristics of the patient. What is the condition or disease of interest? In the next one, you've got the intervention, exposure, or prognostic factor. So when it was initially developed, I stood for intervention, and then to help people think about things beyond just a therapy intervention trial, this is where then exposure or prognostic factor fit into play. So what is the main intervention, exposure, or prognostic factor that you're considering? What do you want to do with this patient? So, for example, in P, you might have a patient with a particular medical diagnosis, and you're curious about a new intervention, a new drug, or a new surgical procedure. Part of this process is to see if this intervention is any better than what's done already. That's where C comes into play, the comparison. So the comparison is the alternative treatment. It may be placebo. It may be standard practice at this time. It may be surgery or an alternative medication, not alternative as in like complementary and alternative medicine, but a different medication, different than the one you're exploring in the I. And then finally, the O is the outcome. What are the relevant outcomes of interest? So this could be things like improvement in one's health state, pain level, morbidity, death, or complications. Now, the other two here, the T's, these are ways, or these are components to help you think about what type of clinical question you are interested in. That's the first T. Is this a therapy question, which probably for the vast majority of you is going to be what you're interested in? Or is it going to be something different, like diagnosis? What's the best way to diagnose a particular condition? There's also the ability to do things with prognosis, prevention, and etiology or harm. The final T is the type of study design to answer the question. And this is just getting you thinking about, okay, if I have an intervention and a comparison group, am I wanting to look at a randomized control trial? Or do I want to have a case control study? We're going to explore that here in just a little bit and also throughout the term, because there's going to be particular research designs that you're interested in utilizing. Any questions so far on PICO? So here are some recommended study designs to answer clinical questions. And knowing the type of clinical question will help determine your best type of study design. So for example, if we look at therapy there, because that's probably going to be the one that the majority of you are interested in, therapy is going to be answered by double-blind randomized controlled trials. If not possible, maybe a single-blind randomized controlled trial. In my discipline, having double-blind randomized controlled trials is difficult to do or sometimes rare to do. When you think about medications, you're definitely wanting to have those double-blind RCTs. There's also systematic reviews and systematic reviews with meta-analyses. So those are some of the optimal study designs for therapy. For diagnosis, controlled trials. For prognosis, your cohort studies, case control, and possibly case series. Same thing for harm or etiology studies. And then prevention would utilize randomized controlled trials or cohort studies. So again, probably for the majority of you, therapy is going to be of interest, an intervention that's therapeutic in nature. And so what does that look like? Well, your P again is going to be your patient or your population of interest. Your I is your interventions, what you're going to be doing for treatment, what you're very interested in. Your C is your comparison intervention. And again, your O is your outcome. As we go across this list here, we can see some of the differences. So for example, with diagnosis, you may be interested in how a new particular test works, whether that is a manually applied test to the patient, think your orthopedic exam tests, or maybe imaging, and you're going to compare that to the gold standard test. Prognosis, looking at prognostic factors or the absence of prognostic factors, and then with the last group here, looking at risk factors or the absence of risk factors. So let me go back real quick, like here to this particular slide. Here is the different study methodology or the different study types of interest. Have you been exposed to, and I know you can't read this, and that's okay. Have you been exposed to the hierarchy of evidence or different hierarchies of evidence? Sometimes this is a kind of a nice starting point to help you understand the hierarchy of evidence, the value of it for potentially answering a question, to see what types of studies are best. This here is from the Center for Evidence-Based Medicine, and this illustrates different levels of evidence based upon the type of question you might be asking. If you're interested in looking at this further, and you definitely don't need to for this week's assignment or for your major assignment, the link is provided here, and you can access that from the PowerPoint in this week's module. The other thing you can do is go to Google and just type in capital letters C, E, B as in boy, M as in Mary, and levels of evidence. Sometimes you'll see within a research paper, a systematic review, or a literature review, the authors presenting the study design and the level of evidence. I only throw this in here just to illustrate that this can be a valuable way for you to kind of appreciate, as you're looking through papers, making notes. Okay, that was a case study, that was a level 5. Where does that fit when I'm developing my paper for this class? Is this something I want to include? Where down below here, there's a couple papers that were randomized controlled trials, and they earned level 2 score for levels of evidence. And that may be something that's more valuable for you. You will find different authors presenting levels of evidence in different ways. They're quite similar, but they may look a little bit different. Again, the whole purpose of me illustrating these is for you to get thinking about the types of studies that you would want to access to answer a particular clinical question. For example, in my world of physical therapy, if I am treating a patient with low back pain, and if I have the choice between looking at a randomized controlled trial and a case report, what should I utilize? Let's say the case report showed a positive outcome for the patient with low back pain, but a randomized controlled trial utilizing the same intervention showed that it was no better than the standard care practice. That would make me start to question if I should use that technique or not, or that intervention or not, especially if the intervention was more expensive. Again, one more slide here showing the hierarchy of evidence, or the quality of evidence. Starting down low here, expert opinion, which is oftentimes listed as a level 5, increasing up to the level 1, the systematic review and meta-analyses. This being the filtered information, meaning this is secondary information here where authors have to do a systematic review, reviewed all of the available randomized controlled trials on a topic. So let's take a look at using the PICO to help guide clinical practice. And one way it's been described is to use the evidence cycle, or the 5 A's of the evidence cycle. There's assessment, asking, acquiring, appraising, and applying. The first A is assessing. The method of evidence-based clinical practice begins with your thoughtful assessment. You're collecting all that information on a patient. In many cases, you're going to know exactly what to do, whether that be prescribing medication, prescribing changes in lifestyle, referring to another healthcare provider. Sometimes, though, you may not have that answer you need to best treat that patient. And so you're going to have clinical questions that come up. And those clinical questions are going to be things that, like, man, what could I do better for this patient? What would be the most appropriate thing? Or maybe it's you have a patient that comes through and it's like, okay, wow, I've heard about this new treatment for this patient population. I don't treat this patient population all that often. It's a rarer condition. I'm curious if this treatment that I've heard about, if it's better than the standard practice. As a PT, as a physical therapist, I may want to know what the best PT treatments are for patients with subacute low back pain. So if somebody is referred to where I practice and they have subacute low back pain. They've gone through that first 1 to 3 days of the acute phase, and they've come to us now. What should I do for them? So this is where the PICO comes into play. Looking here at a PICO for a patient with subacute low back pain. So let's say the patient's a 30-year-old individual. So I have a 30-year-old individual with subacute low back pain. It has been less than 16 days. What is the best physical therapy treatment for reducing pain? I've got that question in my mind. So that's my P. There's my patient or my population. And I can be as specific as I need to be. Sometimes you need to be really specific. Other times it can be more general. So for example, I could further define the low back pain by saying there's no radicular pain beyond the knee, and there's a negative neuro screen. Now, a common intervention that I might use is spine manipulation. I'm curious, though, if spine manipulation is any better than range of motion exercises. That might be standard practice. Or maybe if range of motion exercises isn't standard practice, I may be just curious what is standard practice for physical therapy. Could that be the use of ice or heat or just active movement within patient tolerance? The point here is I'm trying to explore a variety of different things because my patient wants to benefit from my treatment and I want to help them as best as possible because we want to get their pain down. And that's the outcome. Pain score using a visual analog scale 0 to 10. So that's the creation of my PICO. That's going to help me now with searching the literature. I am now going to acquire. So I'm going to search the literature, trying to look for research articles that evaluate spine manipulation for subacute low back pain, range of motion exercises for subacute low back pain, or comparison between the two, hopefully like a randomized controlled trial. If a randomized controlled trial isn't available, then maybe I go to the next level of evidence, a cohort study. Maybe just going to get some pre-test, post-test studies. Maybe there won't even be the comparison between the two. Now, next week, in week number 3, we're going to explore how to search the literature. And in subsequent weeks, we're going to review study designs and the pros and cons of each. Next, appraise, so critical appraisal of the evidence. There are different tools that are out there that can help us appraise the quality of a particular study, help us understand the strengths of it and the limitations. So for example, what's illustrated here is a portion of the QADAS, the Quality Assessment of Diagnostic Accuracy Studies. There's also things like this. This is the modified JDAD. I believe that's how it's pronounced. This is looking at a scoring system for therapeutic interventions. Sometimes you'll find in an article, and I throw this in here because it is from a systematic review, it helps with the kind of appraisal of things. It's the SORT statement. The SORT statements here, the strength of recommendation taxonomy, this does a nice way of kind of looking at a particular clinical recommendation and scoring it based upon available evidence. So what you can see here in the SORT statement, there was a couple different statements that the authors created from this paper, and they gave them B scores, meaning to answer those particular statements, there's inconsistent or limited quality patient-oriented evidence. Now, what does that mean for you? What I'm just throwing out there is the SORT statement is something you might see in certain journal publications that help you evaluate the evidence quickly within a systematic review. Now, there's going to be additional things that we're going to look at throughout the term. I just find the sort very helpful myself. Finally, looking at applying the evidence to the patient. This is the last step, the last A in our evidence cycle. So you had a chance to search the literature, review the articles, appraise them, and now, based upon your analysis of the research articles, did it influence how you're going to practice? Is it going to change what you do for this patient population going forward? Now it's your turn. You're going to create a PICO. Now, this is not the same PICO that you need to create for your major assignment number 1. It can be. You can start kind of rough drafting it, but it doesn't have to be. So in the discussion link, please write out your PICO, your PICO. And for this discussion, you are not required to respond to your classmate posts. I will respond, though. I'll provide feedback and or questions that may further progress your PICO. Let's take a look at an example, something here that may be more medical in nature. And again, I know that at times I'm going to give physical therapy related examples. Hopefully the ones that I give will be very orthopedic in nature or very kind of palpable and understandable to appreciate the concepts that I'm trying to get across. I'm not trying to make you become a physical therapist. And again, as I said before, I'm not going to understand everything that you do. Here's a PICO example, though, that can be medical in nature. Your patient population are adults with a history of ischemic heart disease. You're curious about the Mediterranean diet. You want to know if the Mediterranean diet is going to be a better choice, a better lifestyle change for your patient population compared to the current standard American diet. And what you're interested in exploring is the differences in cholesterol levels and changes in blood pressure. All right, that completes this particular screencast. In the next one, I'm going to introduce your major assignment number 1. And this week, you will also see that there are examples of past student PICO assignments.